Hello, future nurses. This is Professor Flourish. Today we're going to be talking about inflammation and immunity. So when we start out, the first thing we're going to be talking about is inflammation. Hopefully this should be some refresher in your fundamentals course. So inflammation, it's basically this protective coordinated response of the body to any injury or any sort of agent that comes and attacks it. The intensity of this reaction is usually proportional to the extent of tissue injury. So the bigger the injury to the tissue, the bigger the response, and vice versa. The smaller the injury, the smaller the response. There are three basic purposes or three basic goals, which are to neutralize and destroy harmful agents, to limit their spread, and to prepare the damaged tissues for fixing themselves. You have two types. Acute, which is very helpful. That's things like appendicitis or acute pharyngitis. Those are things that the inflammation helps fight whatever agent is coming in and attacking. And then you have chronic, which is not helpful. That means that's like a constant inflammatory state. Those are things like arthritis. So the way I think about acute versus chronic is sort of like a campfire versus a forest fire. Campfires are very helpful, very nice. You get your marshmallows, everything of that nature, while a chronic fire or a chronic forest fire is dangerous to the environment. So you kind of want to think about it that way. Is acute, I'm just trying to get rid of it. Chronic is that staying for a long period of time. You have three different main stages. So the first stage is vascular permeability. Stage 2 is cellular chemotaxis. And stage 3 is your systematic response. So the first stage you have is this vascular permeability. So in this vascular permeability, inflammatory mediators such as your histamine or bradykinin enable the blood vessels to dilate and become more permeable. So vascular permeability, what we're doing is we're allowing these blood vessels to get large and then allowing other things to flow through. So this permits things like fluids, white blood cells, and platelets to travel out to the site of injury or infection. So they're allowing things to move in so we can fight what's ever here. Because if you think about it, your vasculature is basically just kind of like a highway, and we're opening up these highways to send people to go help. Vasodilation enhanced capillary permeability. Fluid flows out of the blood vessels to the injured tissues. So this causes things like swelling, warmth, and redness. So when you see swelling, warmth, and redness, that's coming from that vascular permeability. It's becoming those things because we're releasing all of this in here. We're letting things permit to go through. Histamine is this inflammatory mediator. It can be released from your basophils, platelets, and mast cells. Physical injury, immune reactions, cytokines, and other inflammatory mediators can stimulate this histamine release. So physical injuries, so if I were to prick my finger, immune reactions, so if I were to go around something like a pathogen, cytokines and some of these other mediators are going to release that histamine. Histamine in turn causes vasodilation, contraction of the smooth muscle tissues in the lungs, and acceleration of the heart, which makes sense because if I release histamine, I'm getting that lovely vasodilation. And what we talked about in stage 1 was having that permeability, contraction of the smooth muscle tissues in the lungs, and acceleration of the heart. I'm basically contracting the smooth muscles, and then I'm also increasing my heart rate to kind of help me with this. Some of these signs and symptoms of having a lot of histamine would be things like sneezing, rhinorrhea, which is your runny nose, eye tearing, sinus inflammation, and pharyngeal irritation. And that's all those consequences of having that histamine released in the upper respiratory tract. So these are your cardinal signs of inflammation. You're going to have rubor, tumor, color, dolor, and loss of function. So basically you have redness, swelling, heat, pain, and then the function's no longer working, which we talked about in that stage 1, the redness, swelling, and heat. Because if you remember, all that permeability is just kind of allowing everything to move in here. And then the pain and loss of function come from, we basically encapsulate what we're trying to fight away from everything else. So your macrophages, the fluid that leaves the capillary So the fluid that leaves the capillaries contains white blood cells that are your macrophages. So remember how we were talking about with that vasopermeability and things moving out. So these are your macrophages. The white blood cells surround and consume the foreign material in a process called phagocytosis. So what happens is we've got bacteria here, and then basically these little macrophages eat it, because that's what phagocytosis is, and then they distribute all that stuff they don't need. So this process can result in two types of fluid. You've got purulent exudate and transitant. So purulent exudate is rich in protein from white blood cells, microbial organisms, and cellular debris, and it's also called pus. Transitant contains little protein, is in mainly a watery filtrate of blood, so fluid in a blister. So what happens is, for example, if this is the little pathogen here, my macrophages that got released during that vascular permeability eats this, and then they release this content out. That's that waste material. Now, this waste material here can be seen when we look at the patient as that pus or that purulent exudate, or transitant, which is that watery fluid in blisters. So it can be either one of these, and you'll see it. That's why they say don't squeeze a blackhead or don't squeeze any of these blisters or pop them, because you're basically essentially getting all that waste material and spreading it. So the second thing is your chemotaxis. So what happens in the second form of inflammation is a chemical signal from microbial agents, endothelial cells, and white blood cells attract platelets and other white blood cells to the site of injury. The arriving white blood cells release inflammatory mediators that can either amplify the inflammatory response, attract more white blood cells to the area of injury, or dampen the inflammatory response. So basically, they either amplify, they cause more white blood cells to come up, or they just say, we don't need this. So it's like either saying, I want more, I'm going to continue what I'm doing, or I want less. And these inflammatory mediators are your cytokines and your acute phase proteins. So cytokines, some of the inflammatory mediators released by white blood cells are called or referred to as your cytokines. Examples include your tumor necrosis factor, which is your TNF alpha, and your interleukins, which is your ILs. Cytokines either amplify or deactivate inflammation. So if we're looking at this from step to step, the first step we have is that permeability. I'm basically opening up the gates. From there, the next step we have are these cytokines. So they come in and they look around and they say, do I need reinforcements, or do I have enough, or do I need to deactivate this? So that's like the second phase here. So your active phase proteins. So cytokines stimulate the liver to release a substance called active phase proteins. Some of these examples include your C-reactive protein, CRP, fibrogen, and serum amyloid A. So your CRP, this lab here, is one that we use a lot in nursing, because this is one of the ones that we see whether or not the patient has an inflammatory response. And I'll show you on the next page too what I'm talking about. So acute phase proteins influence the inflammatory process by stimulating, modulating, and deactivating the reaction. So once again, we're either stimulating it, keeping things how they're going, or deactivating. Like always, I feel like knowing your lab tests are very important, especially when we start getting into our autoimmune disorders. So with this, these are your lab tests that are indicative of inflammation. So if you see these are elevated, that means that there's inflammation going on. You have your C-reactive protein, which is usually seen in acute inflammation, your erythrocyte sedimentation rate, which is your ESR, and your leukocytosis, which basically just means high white blood cell count. So these ones too, you're going to see me referring to a lot as we continue on. Leukocytosis is that elevation of white blood cell counts in the bloodstream. During inflammation, the bone marrow releases more white blood cells in there. There are 5 basic types: neutrophils, lymphocytes, eosinophils, basophils, and monocytes. This video here, you can see on momentum, it's just basically a very basic understanding of white blood cells. It is a refresher, so if you want to go back and watch that, feel free to. So the first white blood cells that you will see are the neutrophils. These are the first responders to the site of inflammation, and it's usually seen within 24 to 48 hours. So they begin phagocytosis immediately. They have a short lifespan, usually 10 hours to a few days. And bone marrow basically tries to quickly replace these immature neutrophils. The mature form is called segs. So if you see that written in a chart, that's the mature form. Immature forms are called bands. So this lift to the shift to the left, I just kind of want you to understand what this means if you see it in a chart. So basically what this is when there's a high number of bands. So if you remember, bands are that immature form of neutrophils. So when there's a high number of these present, the clinicians often use the phrase shift to the left, indicating there's an increase in newly formed neutrophils. Elevated blood count with a shift to the left indicates that an acute inflammatory process is occurring. So this is mostly just as a quick-handed way to say, hey, we're seeing a lot of immature neutrophils. That means that we're actively trying to have this inflammatory response. So it's a very quick way to write it. So if you see that, that is what that means in the chart. So your CBC with differential is used to diagnose infection and inflammation. It measures the total number of white blood cells and calculates the percentage of specific types of white blood cells within the total. So an example, a high number of neutrophils may mean bacteria, a high number of lymphocytes may mean viral. So it's just kind of helpful. And my suggestion for you guys is if you're having a hard time knowing what these mean, like you don't know what segs means or anything of that nature, use that diagnostic book that we have or that you may have gotten during your first semester and look up what these mean. It makes a lot more sense once you actually kind of can know these because it's easier when you're studying. So the third phase. So we did the first phase, which was vascular permeability. So that's where we opened up the gates. The second phase was that mediator where we either turn off inflammation or amplify inflammation. And now we're getting to our third phase, which is systematic response. So this is my entire system responding. Persons enduring acute inflammatory or inflammation experience systematic responses. So that's things like fever, pain, a general feeling of poor health, lymphopathy, so that's swollen lymph nodes, anorexia, sleepiness, lethargicness, anemia, and weight loss. So fevers, microbial organisms, bacterial products, and cytokines all act as pyrogens, which are substances that cause fevers. So all these different things act as those pyrogens. Pyrogens activate prostaglandins to reset the hypothalamic temperature regulating center in the brain to a higher level. Higher body temperatures increase the efficiency of white blood cells and their defense of the body and inhibits growth and reproduction of some bacteria and viruses. So basically what happens is you've got some sort of bacterial product or some sort of thing that's come into your system. In order to fight against that, your body has this prostaglandin that tells your hypothalamus to kind of bring up your temperature to a higher degree. An antipyruvate agent is a drug that brings down fever. And I like this picture here because it kind of shows you. You've got microorganisms stimulate white blood cells, and then there's your white blood cells. White blood cells secrete inflammatory mediators, interleukins, and prostaglandins, and the hypothalamic body temperature center reset to a higher temperature. So it's like your brain is basically telling yourself, okay, I need a higher temperature in order to fight what's ever here. So fever can be helpful. However, a fever that's too high can cause seizures or brain damage, which we talked about that in our neuro lecture. It is recommended to keep a fever below 102 for adults using antipyruvate medications such as aspirin, ibuprofen, or acetaminophen. And acetaminophen is generally preferred antipyrenic due to fewer unwanted side effects. These medications can inhibit prostaglandin formation and thus reduce fever. Just as a side note, you don't ever give aspirin to children or adolescents for fever. It's demonstrated a link between aspirin and Reye's syndrome in children and adolescents who have viral infections. And this Reye's syndrome is that liver failure and encephalopathy. So a lot of times with a fever, what you'll have is also a chill. So in a fever, the set point of the hypothalamic temperature center is changed from a normal 98.6 to a higher temperature. Initially, the blood temperature is less than the new higher set point, and the person has a sensation of being cold. The blood vessels constrict, and the body attempts to conserve and generate heat. To reach the new hypothalamic temperature set point, the muscles shiver to generate body heat. So basically what happens is you got that pathogen, prostaglandins are released into your brain. It tells the hypothalamus to go up a degree. And in order to kind of deal with that going up a degree, I'm going to shiver in order to release heat. So that way I can increase my body temperature. So lymphoidiopathy is the enlargement of the lymph nodes caused by the inflammatory process. So your lymph nodes are these small bean-sized masses of tissues that are located in various regions of the body, including the neck, axillary regions, central thoracic region, intergroinal areas, and gastrointestinal tract. Lymphocytes are mature and proliferate within a lymph node. Enlarge and tender lymph nodes during an inflammatory response. So you've got your actual lymph nodes here, and then your lymphocytes are basically just the cells that proliferate within the lymph node. So acute inflammation will result in the outcome of one of the three outcomes. You'll either have complete resolution, so this eliminates the agent, little tissue destruction, and regeneration of normal tissue, healing by connective tissue, so that's fibrous scar tissues, such like a keloid, and replaces damaged cells, or you're going to have a chronic persistent inflammatory response that does not recede. So that's persistence of this agent or interference with healing. So like I said, you can either have complete resolution with a scar basically, or chronic inflammation. All right, the next one we're going to talk about is immunity, but I'm going to put it on another lecture point. So if you have any question about inflammation, please let me know. Thank you.